Hi, my name is Monica Maxwell, and I'm here with Caitlin.
Hi, and I'm Caitlin. I am a former CSR here at DLEAH. CSR stands for Client Service Representative, and that's what we call receptionists in our hospital.
Caitlin and I are going to talk today about difficult clients. Here at DLEAH, we're an emergency hospital, and so unlike a lot of general practices, we don't have long-term relationships with our customers, and they come in emotionally distraught. They're going through something scary. Their pet has an emergency of some sort, and we see a wide range of emergencies that we triage at the front desk, but because of that, we have a highly emotional work environment. We don't have that long-term relationship, and so we do get our fair share of difficult clients. Can you tell us maybe about the top 3 things you see in terms of what makes clients upset at our front desk?
Well, one of the biggest things that will always make a client upset is if they have financial constraints, or really just like the financial side of coming into the clinic, because on top of this stressful, traumatic event, they're also having to make a huge investment that they may or may not be able to make at that time. And so that's always a really big stressor and something that automatically will make somebody upset when they come in. Sometimes if they come in, if they have been into the hospital before, they may have had a bad experience before, or maybe they just tend to not have great experiences at that clinic, so it makes them really anxious and on edge. So that's another reason that they might be upset. Also kind of just like the situation, a lot of times we'll get people in and they've got a million other things going on, and this is just one more thing that got thrown into their day or their month or their life, and now they're even more unhappy, and that kind of, a lot of times we'll see people who just have this big culmination of problems and they kind of dump it all on us up at the front desk.
So what are your tips for when you have a client who's upset, whether it be financial constraints? Maybe we try really hard to always concentrate on service and good service, but maybe they had a bad experience with us once 5 years ago, or maybe they waited too long at some point. How do you diffuse that situation?
Well, it's really important to, and it seems really easy, but it's also very easy to forget, but to really listen to their problem. When someone comes in and they're, they're on the offensive, your natural reaction is to be on the defensive and start coming up with, all of the reasons to like counteract whatever their arguments are, but you really don't want to do that because, they may be focusing on past problems or problems that may not seem as super related, but we just really need to focus, listen to what the problem is right now. What can we do to fix this right now? And really pay attention to all the points that they're bringing up so you can work on making this experience a better one for them.
So let's say it's an issue like financial constraints. Let's say I bring my dog, who's about 2, in, and he's got hit by a car, and I don't have the money for the surgery needed. Let's say he needs an orthopedic or something. What's some strategies that you and the staff use to kind of help me and kind of diffuse my anger so that we can make decisions together?
Well, it's always good to let them know that you understand, because it's a position that a lot of people have been in, and being able for them to know I'm talking to somebody who kind of knows what I'm going through can really help them. Of course, don't like interject with your stories. Yeah, when that happened to me, because that's going to really go negatively, but starting there, and then so what are your financial concerns? What are you capable of? What are you not capable of? What can we answer right now? Since we are an emergency room, we do have to ask, for example, a trauma like a hit by a car. Would you be okay with them performing CPR if necessary? Can they start immediate treatment? And then finding out kind of bits and pieces from there so we can let the doctor know right away. And I do let them know, this is what we're able to do at this point. We're going to have you talk to the doctor more, let them know your financial concerns, and we'll come up with a game plan from there. And we are lucky to have some financial assistance available, but it's not suitable for every case. But as long as we, let them know, we're going to talk to you, we're going to come up with the best plan given the situation, and that does seem to help calm them down at least a little bit until they can talk to the doctor.
So here at DLEAH, our doctors are actually the ones that give the estimates, but you all get a lot of financial questions at the onset. What's your tips for communicating with the back, especially when they're busy and stressed?
I always, as soon as I know that there are financial constraints, I let them know right off the bat, this person is having some financial concerns and you might want to talk to them before doing a ton of stuff. And we do have sheets that we have the owner fill out that has them sign off on what they're comfortable with. But sometimes, an owner might say, I don't have any money, but please do anything that you can. So I'll make sure and translate that to the doctors in the back. That may not be realistic to them, but I'm at least communicating what their wants and needs are.
And then what do you do to kind of be proactive? So financial constraints come to you at the onset, but we get other complaints, like maybe people get frustrated because they have to wait, or they might not understand the triage process. What's your goal from a proactive standpoint when you're at the front desk, kind of trying to keep everyone from asking a lot of questions or keep them updated?
I make it a general rule every 30 minutes. If somebody hasn't heard about their pet, then they've waited too long. And so we have a list of all the patients that are in hospital up at the front desk. We have like a little time slot where we can write down when's the last time this person was talked to, whether it was one of the receptionists, a technician, or a doctor. And every once in a while, especially on busy nights, sometimes I'll just write a list of these 10 patients haven't heard from anybody in a while, and I'll just go back to ER, go around and ask, and sometimes the doctor's not available to answer, how Fluffy's doing, but I'll at least put eyes on the pet and say, I just went back and checked, resting comfortably, they're keeping it a close eye. And if somebody has other concerns, like I'm not happy with what the doctor had to say, sometimes just offering like a lending ear. I mean, there's not a whole lot you can do in that situation, except maybe find out, well, did you tell the doctor these concerns? Then going back and letting the doctor know if they didn't feel comfortable saying it in that moment.
Great. And do you have any other tips for managing the front desk in highly emotional situations?
If someone is getting really, really riled up at the front desk, if you can get them in an exam room would be really helpful, because those emotions will kind of rattle everybody else in the lobby. Someone's out there and they're like screaming and they're crying and they're swearing. You really want to get them kind of contained. And sometimes they don't want to go into an exam room. Sometimes I'll offer, hey, do you want to go? We have a bench outside. Do you want to go sit outside for a sec? If it's, if it's okay with my fellow CSRs. And kind of just let them be wherever they're the most comfortable, because that's going to be the best for their sake and for the other clients in the lobby, because you kind of have to keep them in mind too, because they're stressed out, and whether or not they're expressing it in the same way, a screaming, yelling client in the lobby is going to make them really upset.
Okay, great. So just to recap, when you have a client you're trying to diffuse, it sounds like the best thing to do is listen, give them options, and then if we can't calm them down, to kind of put them in a place that's separate from everyone else to keep everyone else calm.
Yeah.
Well, that's what we do here at DLEAH with emotional clients. We'd love to hear about what you do. Comment below.